Hi.
Hi, I'm Mac McGonigal, and I have a 9:30 appointment with Dr. Wade this morning.
Okay, let me check, Mac. Okay, you can have a seat, and the doctor will be with you shortly.
Okay, thanks.
Dorothy, I don't feel good.
What's wrong?
I don't know, I just feel bad.
Are you gonna be all right? Raymond? Raymond, can somebody help me?
Man, what happened? What's going on?
I don't know.
Mister, hello, mister, are you okay? Mister, would you go dial 911, please? Don't hang up until the operator does, and then come back and tell me when you've done it. Thank you. Sir, can you help me move this table, please? Thank you. Can you help me get him out of the chair? Man, we're gonna get him on the ground, and I'm gonna perform CPR. Let's get him on the ground, on his back. Thank you, thank you. 1, 2, 3, 4, 5, nothing. One, 2, 3, 4, 5. Nothing. No movement, no coughing, no breathing. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14 and 15.
The ambulance is on its way.
Thank you. 1 and 2 and 3 and 4, 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13 and 14 and 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14 and 15. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. And that's how you do CPR on the adult in an emergency. Hi, I'm Mac McGonigal. I'm a CPR instructor certified with the American Heart Association. I received EMT training in the Navy. After I left the Navy, I went to work for Ballard Ambulance in Wenatchee, running calls night and day for 8 years. I've done CPR numerous times in my life. What I'd like to do is teach you the new American Heart Standards. These guidelines may be different for you, but I'd like to teach you adult, child, and infant CPR, as well as how to help a choking victim. Now, the purpose of this video is for you to practice and review these techniques several times a year. I'd also like to teach you how to recognize and identify the signs and symptoms of a heart attack. Now, let's get ready to save a life. You need to know how to identify the signs and symptoms of a heart attack, because I believe there's a heart attack coming to a neighborhood near you. Would you know how to identify it? Someone having a heart attack is sweaty, they're physically weak, they're pale, they have this chest pain. It's not a typical chest pain, it's a heaviness, tightness, squeezing pain. Sometimes it's described as though an elephant is sitting on my chest. Help! There's a radiating left arm numbness, and the left side of the face and jaw goes numb. There's a feeling of impending doom, denial, and shortness of breath with somebody having a heart attack. See, when somebody's having a heart attack, part of their heart muscle is dying. And that heart muscle, if it goes, it could stop the heart. That's called cardiac arrest. You need to act fast. You need to sit them down and you need to tell someone or you yourself need to go and dial 911. Do not let them talk you out of dialing 911. You are one call away from saving a life. Dial 911 right away. That's going to save a life. There are 3 categories to CPR. Adult, 8 years old and older, child, 1 to 8 years old, and the infant, birth to 1 year. The goal in CPR is to get oxygen-rich blood to the brain, because when the heart stops, it's no longer pumping oxygen to the brain. So the ABCs are crucial. They are directional. If you can remember the ABCs, you will never forget how to do CPR. So let's begin on the adult. This is how you do it. Mr., you okay? Mr., you okay? You go dial 911. Don't hang up till the operator hangs up. Come back and tell me when you've done it. Or if there's somebody else there, have them go dial 911 and then return. Once the ambulance is on the way, you've dialed 911, you get in front of this dead person, you want to remember your ABCs. A stands for airway. You open it. B stands for breathing. Are they? I don't know. I need to look, listen, and feel for 5 to 10 seconds. 1, 2, 3, 4, 5. I don't see, feel, or hear anything. I'm going to keep the airway open, plug the holes in the nose, get a good seal around the mouth with my mouth, and give 2 good, slow breaths. Each breath should take 2 seconds. Let the chest rise and fall. Let the chest rise and fall. C stands for check for signs of circulation. That would be breathing, moving, coughing, talking. So what I'm going to do is hang out here for about 2 to 3 seconds. 1, 2, 3. I'm going to scan the body to see if there's any movement or coughing. And if there are none, I need to do compressions. What I want to do is expose the chest. Find the nipple line. Place your heel right in the center of that nipple line. Place your other hand right on top of it. I like to interlock and pull back. You need to get right next to this patient. Get up. Arms should be locked, and what you should be looking down at your hands and compress the chest a little faster than 1 per second at the depth of 1.5 to 2 inches. Ready? 1 and 2 and 3 and 4 and 5, 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. Each compression is separate and distinct from the other. After 2 breaths and 15 compressions, that constitutes 1 cycle. And what you would do is go back, open the airway, give 2 good full breaths, come back, find your hand placement on the center of the chest, heel, place the heel of the other hand right on top, interlock, arms straight, looking down at your hands, shoulders over your hands, and compress the chest 1.5 to 2 inches. 1 and 2 and 3 and 4, 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13 and 14 and 15. That makes 2 cycles, 2 and 15. Each cycle takes about 15 seconds. And you would continue to do these cycles until you've done 4 cycles of 2 and 15. After the 4 cycles, you want to give 2 good full breaths and then check for signs of circulation. No signs of circulation, no breathing, no moving. You want to continue chest compressions for another minute and continue this process until help arrives. Let's practice. Now, let's practice adult CPR, slowing it down a little bit, going step by step. You ready, James?
Ready.
Let's do it.
Mister, you okay? You go dial 911. Don't hang up until the operator hangs up. Come back and tell me when you've done it.
That's good. Now, if you're all alone in this situation with an adult and there's a phone in the general vicinity, you go dial 911, give the operator the information, and then come back and begin CPR. Always remembering your ABCs. Go. A, open the airway. B, look, listen, and feel for breathing for 5 to 10 seconds. 1, 2, 3, 4, 5. And if you don't see, feel, or hear anything, after 5 to 10 seconds, give them 2 good, full, slow breaths. Each breath should take 2 seconds. Make sure the chest rises and falls. After giving 2 breaths, C stands for check for signs of circulation. That means breathing or movement or coughing for 5 to 10 seconds. 1, 2, 3, 4, 5. You scan the body. If you don't hear any breathing, he's not moving or coughing, it's time to do compressions. What you want to do is expose the chest, center your heel on the sternum in between the nipple line, just the heel of your hand. The other hand, put right on top of that hand. I like to interlock and then pull back. Get right next to the victim, get straight over him. Your arms should be locked. Your shoulder should be right over your hand. You should be looking down. You do 15 compressions, a little faster than 1 per second. It's 1.5 inches to 2 inches. Ready, James? Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
That's 1 cycle. After that first cycle, do 2 and 15 again. Open the airway. Give 2 good, full breaths. You should see the chest rise and fall. And go right back to the chest. Find your hand placement every time. In between the nipple line, get straight up, lock your arms, go straight down.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
That's good, James. We've just done 2 cycles of 2 and 15. To complete this segment, you would do 4 cycles of 2 and 15. After those 4 cycles, give 2 breaths, and then check for signs of circulation. If you don't hear any breathing, they're not moving or coughing, continue. Do 4 more cycles. Keep doing it until help arrives. That's how you do adult CPR. Over 3,000 people will die this year due to choking. I call it 4 inches to death. When somebody's in distress from choking, they'll usually display the universal signs for choking, like this. When you see this sign, ask someone to go dial 911 right away. And when they're choking, ask them these questions. Can you speak? Are you okay? When they can't speak, you need to perform the Heimlich maneuver. You do this by positioning yourself behind the patient. Find the belly button. You want to be about 1 finger width above the navel with your fist. With the other hand, grab that fist and make upward thrust until the object comes out or until help arrives. That's how you take care of the conscious choking patient. Now, if the patient goes unconscious from choking, lay him on his back, open his airway, pull down on his chin, visually inspect the airway, never blindly sweep. But if you know that you can stick your finger in there, knock it over to the side and bring it out, that's the only time you would attempt that. But if you can't see the object, attempt to ventilate. If the chest doesn't rise and fall, just do 15 compressions, just like you were taught in CPR. 1 and 2 and 3 and 4 and 5, 6 and 7 and 8 and 9, 10 and 11 and 12 and 13 and 14 and 15. Open the airway, visually inspect. If you can't see it, attempt to ventilate. And just continue compressions just like you were taught. That's the unconscious choking patient. The American Heart Association advocates the use of an AED, automated external defibrillator. If there is one nearby, when you dial 911, ask them to go get the AED. Now, this will be somebody who has the training to apply this technology in an emergency. And it's as simple as getting one of these devices, applying 2 patches on the chest, one here, sometimes on the back, sometimes on the side. It's totally self-automated. You turn it on and it talks you through it. So if you're ever asked to be certified, say yes. It'll save a life. Now, I would like to teach you how to do child CPR. I use what I call the Formula One CPR system. There's one main theme running through this sequence. See if you can pick it up. The child is 1 to 8 years old. You only need one hand. You go down on the chest 1/3 to 1/2 the child's depth of his chest. And it's 1 breath, 5 compressions. That's the one thing you need to remember. The Formula One. Remember that, and it's a lot easier to do CPR. Now, let me show you how to do it. First thing you do is, Skippy, Skippy. Are you okay? Skippy. If somebody's in the room, you ask them to go dial 911. Don't hang up until the operator hangs up. Come back and tell me when you've done it. That's great. Now, after you tell them to go dial 911, you remember your ABCs. The ABCs are crucial, and the ABCs are directional. They give you direction. You need to remember your ABCs. A stands for airway. You open the airway. Hand on the head, 2 fingers underneath the chin, pull back. That's head tilt, chin lift. B stands for breathing. Are they? I don't know. I need to look, listen, and feel for air. So I get my face down into his. I look down the chest. 1, 2, 3, 4, 5. I'm looking for the chest to rise and fall. I'm listening and feeling for air being expelled out of the mouth. I didn't see the chest rise. I didn't feel or hear any air being released. After 5 seconds, if I don't see, feel, or hear anything, I'm going to pinch the nose, get a good seal around the mouth, and give 2 good slow breaths. Each breath should take 1 to 1.5 seconds. Let the chest rise and fall. Let the chest rise and fall. Listen and feel. C stands for check for signs of circulation. Maybe movement or breathing or coughing for 5 seconds. Nothing. Now what I need to do is perform chest compressions. And what I'm going to do is take the heel of my hand and put it on the lower portion of the sternum, not too low, the lower portion of the sternum with just my heel. My arms should be locked. I get straight over this patient looking down, and I perform compressions a little faster than 1 per second. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. You keep this up for 1 minute. It's actually 20 cycles. It's easy to remember if you think about it in increments of 1 minute. Now, after that minute, give a good breath and then check for signs of circulation. If there are none, continue CPR until help arrives. That's how you do child CPR. Now, let's practice child CPR. You ready?
Ready.
Let's go. Skippy, Skippy, are you okay? You go dial 911. Don't hang up till the operator does. Come back and tell me when you're done. Thank you. Now, remember your ABCs. Open the airway. Look, listen, and feel for breathing. 1, 2, 3, 4, 5. I noticed the chest didn't rise. I didn't see or feel or hear anything out of their mouth. So now we need to give 2 good, slow breaths. Each breath should be 1 second to 1.5 seconds. Pinch the nose, get a good seal around the mouth, give 2 good breaths. Listen, 1, 2. Now check for signs of circulation. 3, 4, 5. I didn't see any movement, any coughing, nothing. Now we need to perform chest compressions. With the heel of your hand on the lower portion of the sternum, not too low, find your hand placement, just your heel, arms should be locked, you should be looking down. Let's perform the compressions. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. Now, you would continue to do this sequence for 1 minute. That would equal out to about 20 cycles. But it's easier in terms of thinking about it in increments of a minute. It's hard to think about 20 cycles at this point. Now, until help comes, you perform CPR. And that's how you do child CPR. Children and choking. It's always a scary thing. Now remember, children are 1 to 8 years old. What I want to do is demonstrate what is commonly referred to as the Heimlich maneuver. Most kids choke on food or toys. And so what we're going to do is go through step by step how to relieve a foreign body in the throat. I'm here with my daughter Rachel, and the first thing kids do when they choke, or should do, and you should teach them, is the universal sign for choking. Rachel? Are you choking? Can you speak? When this happens, you should point to somebody and they should go dial 911 immediately. Come back and tell you when they've done it. Now, when they're choking, get behind them and find their belly buttons with your middle finger. Now, with your other hand, that thumb should rest on top of the fist. The thumbnail side should go into the belly just above that finger on the belly. Release that finger that's in the belly button. Get a good grip on the fist that's in the belly and go up and in 5 times until that comes out. If not, are you choking? Continue to do that until the object is dislodged. Now, one thing you got to be careful of are the ribs. You're just above the navel and below the xiphoid process. That's how you take care of a choking child. Infant CPR, birth to 1 year old. Let me show you. It goes like this. Skippy, Skippy, you okay? Skippy, Skippy. If he doesn't wake up, respond or come to, and somebody else is around, have them go dial 911. Don't hang up till the operator does. Ask them to come back and tell you when they've done it. Or, if you're the only one there with the infant, perform CPR for at least 1 minute. Pick the baby up and go to the phone. Dial 911, give the operator the information, and then come back. Now, when you begin CPR, you always begin with the ABCs. A stands for airway. What do you do with it? You open it. You gently tilt the baby's airway slightly back. B stands for breathing. You look, listen, and feel for breathing. 1, 2, 3, 4, 5. If I don't see the chest rise and fall, if I don't hear or feel air coming out of the mouth, I give 2 good breaths. Each breath should take 1 to 1.5 seconds. And when I breathe, I cover the baby's nose and mouth with my mouth, like this. Two good breaths. Then C stands for check for signs of circulation. 1, 2, 3, 4, 5. I'm checking for movement, coughing, or breathing. If I don't see any of those in 5 seconds, what I need to do now is chest compressions. What I do is I start with my hand closest to the feet. With these 3 fingers, I take my index finger and find the nipple line, slide it across till I come to the middle, and then I lift that index finger. So now I have these 2 fingers straight up, and now what I'm going to do is perform chest compressions. 1/3 to half of the baby's chest I'll compress, a little faster than 1 per second. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You would complete 1 minute of CPR, or about 20 cycles. It's easier to approximate 1 minute. And then after 1 minute, you give a good breath, and then you check for signs of circulation for about 5 to 10 seconds. No movement, coughing, breathing. You keep on doing CPR until help arrives. CPR should always be done on a hard surface. And if it helps, put a towel or something behind the baby's back. That's how you do CPR on the infant. Now, let's practice infant CPR. You ready?
Ready.
All right. Skippy, Skippy, are you all right? You go down 911. Don't hang up till the operator does. Come back and tell me when you've done it. All right. Remember your ABCs. A, open the airway. Tilt the head back gently. B, look, listen, and feel for breathing. 1, 2, 3, 4, 5. I didn't see, feel, or hear anything. So after 5 seconds, what you want to do is cover the nose and mouth with your mouth and give 2 good slow breaths. Each breath takes 1 to 1.5 seconds. Let's do it. Now just listen for breathing. 1, 2. And then check for signs of circulation. 3, 4, 5. No signs of circulation? Do compressions. Now, with the hand closest to the baby's feet, start with 3 fingers, find the nipple line with the index finger, run it across into the center, stop right in the middle, lift. Now you have these 2 fingers straight up off the baby, and what you want to do is compress 1/3 to 1/2 the depth of the chest. You ready? 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. Now, what you would do is continue this sequence for about a minute. So that's about 20 cycles. And then after that minute, you give a good breath, and then you check for signs of circulation. If there's no signs of circulation, continue CPR, or until help arrives. But if you discover a baby's unresponsive and there was no one to send to the phone, what you can do after 1 minute of CPR is pick this baby up, run your arm down the back, support the head, and then you can begin to do compressions and breaths on the way to the phone. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And you continue this till you give the operator all the information she needs. You wait till she hangs up, and then you come back and continue CPR just like you've been taught. And that's how you do infant CPR. This is how you would help a choking infant. Now, the most common reasons why an infant would choke would be their tongue is swollen, or that tongue would fall on the back of the throat, or maybe they swallowed some food, or maybe a toy. This is what you would do. Grab their chubby little cheeks, run your arm down the length of the body, pick them up off the table, get him on your thigh. What you want to do is perform 5 back blows. 1, 2, 3, 4, 5. Be careful not to involve the head or the neck. Extend your arm, grab the back of their head, run your arm down the length of their back, roll them. Get them on your other thigh and perform 5 chest thrusts. 1, 2, 3, 4, 5. If they're still conscious but not breathing, do it again. 1, 2, 3, 4, 5. Extend, grab the head. 1, 2, 3, 4, 5. Still conscious, no breathing. 1, 2, 3, 4, 5 back blows. Now you can do this on your knee too. You can do this 1, 2, 3, 4, 5. Now, if the baby becomes unconscious, then you would do CPR. But folks, that's how you take care of a choking baby. If the patient starts to breathe or have purposeful movement, now what you need to apply is rescue breathing. Rescue breathing is the concept of making sure the adult gets one breath every 5 seconds. And it goes like this. 1, 2, 3, 4, 5. If they didn't take a breath on their own, you give them a good, full rescue breath. And then you keep right down here to see if they're going to breathe in the next 5 seconds. If they do not, give them a rescue breath. If they do breathe, wait till they breathe and then count another 5 seconds. If they don't, give them a breath. Rescue breathing on the adult. On the child, 1 to 8 years old, rescue breathing is 1 breath every 3 seconds. Same with the infant. 1 breath every 3 seconds on the infant. Thanks again for watching the video. Let me just encourage you, several times this year, get the video out, practice and review the techniques that you've learned. Remember, this video doesn't certify you, it's just good practice. Now, I'd like to thank members of my family, my wife for all her support, my kids, Melissa, James, and Rachel for helping out during the video. I'd like to thank the First Baptist Church for allowing me to use their facility during the filming of this video, and all their love and support over the last year. I'd like to thank Dr. Wade's office and his staff for allowing us to use their building as well in the filming of this video. And remember, the ABCs are crucial to doing CPR. They're directional. They give you step-by-step directions to help you save a life. Well, I've developed what I call the heavenly ABCs. And they are this. A stands for admit. Admit we've missed it. Admit we've missed the mark. We've offended God by our self-centeredness, our rebellion. B stands for believe that God saw that and sent His Son for you and I because we missed it. And C stands for make Him, confess Him as the Lord of your life and commit to following Him for the rest of your life. Thanks again for watching, and God bless.